Hi, for those of you who don't know me, I'm Vicki Spralunga, and I'm the Director of Clinical Development here at Berkshire Medical Center. I'm going to talk to you today about the patient experience, and what I'm actually going to talk to you about is my own personal patient experience and the effects that that had on me being on the other side of the fence and actually being a patient. The story I'm about to tell you is something that I hope never happens to a patient here at Berkshire Medical Center, because I will tell you that my experience did not happen here at BMC. However, I think we should also keep in mind that this story could happen at any hospital. So I'll tell you my story. About 5 months ago, I was having back pain and needed back surgery. I had never had surgery before, so this was a whole new experience for me. I went to a neurosurgeon and was admitted to the hospital for day surgery to stay overnight. My first experience, I'd never been intubated, I'd never had anesthesia, so the whole surgical experience itself was new to me, and I was not given a lot of information beforehand so that I could deal with that. I was admitted and sent to surgery. As soon as I came out of surgery, I immediately started vomiting from the anesthesia. So I was having a hard time in the PACU itself, not knowing what had happened. My throat was sore, I couldn't speak. So at that point, my husband was waiting for me upstairs in the surgical waiting area. They called him and told him that he could come down to see me, that I was in the recovery room. So about a minute later, they told him that he was not able to come down and see me because I was in distress. So at that point, he was very worried. Obviously, when you say your wife is in distress, he didn't know what that meant. So he was allowed to come and see me for a minute, and then he was gone, and he went back home, which was about an hour from the hospital. So I was taken up to my floor, brought into the room by the nurses from the recovery room, and they told me that they would let the nurses on the floor know that I had arrived on the floor. I had excruciating pain at that point. I was about a 10/10. Still had some nausea. I had just been vomiting, like I told you, down in the recovery room. So I was very, very uncomfortable. So I waited in the room. I could actually see the clock out in the hallway. So I waited for what I thought was in a reasonable amount of time and put my call bell on, because I was hoping someone would come in, not only to help with the pain, but to do my admission process. So about 30 minutes later, I still had not had any nurse or anyone come into my room. So a young gentleman came in the room who did not identify himself and told me, I asked if I was going to be admitted, and I was having 10/10 pain. And he told me that I was actually next on their list and they would be right in. So at that point, I was down in the bottom of the bed. My feet were actually hanging over the bed, so I knew I needed to pull myself up. So I tried to pull myself up in the bed, which caused horrific spasms in my back, so now my pain was even worse. About 10 minutes later, the young gentleman came in again, and I found out, he told me he was a nursing student, his first day, and he would be doing my admission. I was so sick and so uncomfortable that I was unable to answer the questions for the admission. So I asked if I could be medicated, and then I told him that I was also having this severe nausea. So he told me he would get the nurse and would come back. So I waited about 15 minutes again, put my call bell on, and I'm assuming a nurse came in. The only way I know she was a nurse is that I had seen a sign in the lobby that told me that the nurses wear blue, and this woman had on blue. Her name badge was turned around so that you couldn't see what her name was or her status, and I wasn't really sure who she was or what her job was. So she told me that she would come in and give me some medication, and I told her at the time I was still very nauseated and had been vomiting in the PACU. So about 10 minutes later, she came in and she had given me some morphine and Zofran and told me that she would be back to check on me at some point. So I held off for as long as I could. I had the nausea. I was trying desperately not to vomit because I didn't have anything to vomit into. I didn't have an emesis basin, I had nothing, and putting on my call bell didn't seem to bring anyone to my bedside. So at this point, I tried desperately to not think about the pain, not think about the nausea, but I knew I had to vomit. So I vomited, and I was afraid that if I vomited on myself, that I would end up laying in that. So I actually had to swallow my own vomit. So a few minutes later, I had my call bell on, vomited again, and had to swallow my own vomit again. So finally a young man came in. I don't know what his name was again. There was no name badge on. And told him I needed to vomit, so he brought me a wash basin, put it on the edge of the bed, and left the room. So in the meantime now, we're talking 2 or 3 hours later. I'm still sick, a lot of pain. And my care board, they had the care board like we do here, you can see behind me, was totally blank. There was no nurse's name. I didn't even know what room number I was in. There was absolutely nothing on that care board. So I put my call bell on because I wanted to see if I could get more medication for the pain. And at that point, it was about supper time. So the nurse came in. Again, I'm saying nurse. I assume she was a nurse. And she asked me where my supper tray was. And I said, I didn't get a supper tray. And she said, well, it's too late now. The kitchen's already closed, so you're not going to get anything. So with that, I asked if I could at least have some soup or something. So they brought me in some saltine crackers that were crunched up pieces of saltine crackers, and some water, some cups, some straws, and some mouth swabs because my mouth was really dry at that point. So when I tried to reach over to pour the water and get the crackers, I knocked the cups off and the straws off, and the crackers pieces went everywhere, and just made a mess at my bedside on my table. So again, I realized then that putting my call bell on certainly wasn't going to get me any attention or any help. And my bedside table with my phone was beyond my reach. My bag that I had my cell phone in was beyond my reach, so I really was being held prisoner, basically, in my room. So at change of shift, there was no bedside handoff report. I could hear the nurses at the doorway talking, but nobody actually came to my bedside to report off, introduce themselves, or give me any information about what was going on with my care. So it was at that point that the nurse coming on decided that the morphine was probably what was making me vomit. So she stopped the morphine and started me on Vicodin by mouth. So if you remember me just telling you I'm vomiting and they're going to give me pain medication and Valium by mouth. Never addressing the pain, never asking me what the pain scale was. So about 15 minutes later, this young gentleman came in again, who I'm assuming was a nursing assistant, to tell me that he was going to straight catheterize me because I had not voided yet. And I said, no, you're not going to do that because first of all, I don't want to get a urinary tract infection, and secondly, no one has gotten me up to go to the bathroom to void. So he said, well, he was very annoyed and said, I'll have to go get a hat. Now, if I weren't a healthcare worker and someone said to me, I have to go get a hat, I would be thinking to myself, well, you have to go get a hat before you can take me to the bathroom? I don't know what that means. So I said to him, I'll estimate how much urine, cc's, milliliters, whatever. And he said to me, are you a nurse? And I said, actually, I am a nurse. And he said, oh, where do you work here? And I said, no, I don't. I work at Berkshire Medical Center. So he got me up to the bathroom, which of course now I'm still vomiting on the way to the bathroom. I'm coming back from the bathroom. And he left me in the bathroom. Never came back when I put the call bell on. So I got myself back out of the bathroom with my eye back and my bucket and got myself back into bed. And it was then when I really realized, thinking to myself, I'm either going to die here tonight, I'm on survival mode, it's up to me now to make it through the night, because there was absolutely no care being provided to me at all. So when I was in the bathroom, I could hear some congestion in my chest. So I realized that I probably needed to start turning myself, because no one was coming in doing hourly rounding. There was no turning and positioning, there was no toileting, there was no pain management. So I started turning myself in the bed, which you can imagine was painful. And my incentive spirometer was back behind me on the bedside table next to my phone. So I was doing coughing and deep breathing on my own. About 10 o'clock that night, my phone rang, which of course I couldn't reach because it was behind me. And the nurse came in and said, you have a phone call at the desk. Do you want me to put it through to you? And I said, I don't. I said, I'm too sick right now to talk to anybody. I have too much pain. I can't. So a few minutes later, she came back in the room and she said, the phone call was your neurosurgeon. He was calling to check on you to see how you are. And I said, oh, thank God. I said, did you tell him about the vomiting and how much pain I'm having? And she said to me, actually, she said, I told him you were doing really well and that we were managing your pain. So with that, I figured I might as well, I really wished I was home, because I would have been doing better taking care of myself at home. So as the night went on, the night shift out at the nurse's station, it was so noisy. And I understand that when you come on at night, that's your shift, and that's when you've just gotten out of bed, and that's what you're doing. But the laughter and the noise went on the whole entire night. And it felt disrespectful to me to have people, having so much fun when I was suffering. So sorry. So here I am 5 months later, almost 6 months, still trying to tell my story, and you can see how emotional and the things that we do, how it affects the patient's experience. And I can tell you that if you ask me what went right, I couldn't list one thing that went right. But I do know that if you connect the dots between hourly rounding, bedside handoff, turning, positioning, care board, just introducing yourself to that patient can make all the difference in the world, because all of those things that happened to me would have stopped if someone had just paid attention, cared, and actually spent some time with me. There was no personal connection made to me whatsoever. I thought maybe once they realized I was a nurse, that was going to change things. Although it shouldn't matter whether you're a nurse or what you do, the treatment, the care that you're given. So the following morning, my husband finally got there, and my room was an absolute disaster between the bucket on my bed with the vomit in it, all of the things that I had dropped on the floor. Everything was still the same way it was from the evening before. So the thing I wanted to do was I just wanted to go home. So the nurse told me, this is the same nurse that I had the day before, that I could go once I saw physical therapy. My physician came in and I had eaten something. So again, I got no breakfast tray, so I had to go through that again of trying to get something to eat. So I ate a little bit, physical therapy came in, my physician assistant came in, so I put my call bell on. It was about 10:30, 10:45, to see if I could go. My husband had gotten me dressed, and I just wanted to leave. So she said, "You can leave. I told you at noon." So at 12 noon, she came in to my room, and I said, "Can I go?" And she said, "I told you 12 noon, you can go now." And I said, "Okay." And she pointed to a wheelchair. She said, "There's your chariot." And she pointed to my husband and she said, "There's your driver." So my husband had to discharge me. So there wasn't even a connection there to say, "Are you going to be okay at home? Can I help you get out of bed?" We were left on our own in a hospital where we don't even know where the front door is. So from the time of admission right up until the time I went out that front door was probably one of the worst experiences of my life. And I want to make a point of telling you, I have gone back to that hospital and I did a nursing grand rounds and I spoke with the staff of that unit so that this patient experience, doesn't happen again, because it's so important and it really makes a difference. Thank you.